good morning, all of you. And for that purpose, we have come online and we are testing first time this online medium and this COVID-19 crisis where science centers or science communicators can play crucial role. For that purpose, we are trying to understand today how science communicators can play important role in this crisis. So for that, we have today with us our panelists from different locations. So I should introduce first Dr. Jayaraman sir from Mumbai only, and he is the chairman of National Centre for Science Communicators, and Sri Jawaid Hanji, the science editor of Science magazine, science reporter, and also chief scientist in NISCAIR, CSIR. And we also have with us Sri Pallava Bagla ji, and he doesn't know, he doesn't need any introduction at all. So he is very known for his writings and also as a photojournalist and also contributing in Getty images and science magazines. And we have with us our Sir Shivaprasad, Khened, Director, Nehru Science Centre. Sir, stage is yours. Now you can carry forward.
Okay, I mean, basically this is the first time that we are attempting this platform to try and see like how we can use the digital platform when we have been asked to stay at home and ensure that not only we are safe but our community is safe. So under these circumstances, what role does the science communicators have, or for that matter the science centers have, more so since our doors are now closed to the public. So may I request Jawaid, who has an expertise in this, that you've been doing a lot of things on virtual platforms as well, and primarily you're very active in trying to to falsify those infodemics that are dime a dozen being spread in the WhatsApp groups. Jawaid.
Yeah, thank you, Dr. Khened. You're very right. WHO actually called it an infodemic, and this is the first time that tech giants have taken notice of the amount of misinformation that has been flowing right from the day that the pandemic was announced. And I've been going through literature where I find Facebook has taken very active interest in actively removing content that was malicious, that was fake, which it has never done. It always had a hands-off policy. And Google has invested almost $6.5 billion in setting up fact-checking networks throughout the world. There are many other ventures also. For example, NewsGuard Tech has listed around 150 websites which have been posting information that is false or not updated or just mainly unscientific. So misinformation has come as a very big challenge in the flow of information communication in this pandemic. And we find miracle cures, sensational headlines making rounds of social media, and also phishing activities which have been done because of the propensity of human beings to gravitate towards sensational headlines. Websites have been set up which simply give sensational headlines, and people visiting those websites, their entire data is stolen. So misinformation and communication of information that is false, mischievous, totally, is indeed a big challenge. And we as communicators need to see communication today, especially in these trying circumstances, is not just dissemination of information. It's also trying to analyze, assess, evaluate, and then share information that is correct. So that is a big responsibility of science communicators today.
Thank you so much, Jawaid. Dr. Jayaraman, you've been very active in science communication, both in your capacity as the chairman of the National Centre for Science Communicators, but also heading the STEAM Academy that you've started. You've been very proactively engaging school students and public in storytelling concepts, which I think are very appealing. under these trying circumstances, when there is so much of fear among the people, there is fear mongering, the numbers are very staggering, and people sometimes compare that with the 1918 epidemic, which actually killed about 50 million people. Under these circumstances, how do you think that in a very light-hearted manner, how do we communicate the issues, the serious issues on COVID, but simultaneously ensuring that you're very safe, and what the do's and don'ts for the general audience is?
Well, Khened, that is the Herculean task today. We have just got earlier speaker has informed us that information is in crisis. Theoretically, information is negative entropy. It's a measure of the disorder of the system. But today, information is creating more disorder than order. That's precisely the problem. We have not only misinformation and disinformation, we also have infected information. Therefore, myself and my learned colleagues from the Kerala Session had a brainstorming or a brain dancing session. We thought, what is the historic role science communicators can do in these very turbulent times? We thought that the less we communicate, the better. That's a paradoxical statement. As science communicators, we are conscripted to give communication now. And there has been a plethora of communication originating from us. From second-hand information, third-hand information, swept up by the industrious housemates of informants. What is required is a reticence, a self-regulation, that when information is being born at an inexorably high rate, be able to find out, as Jawaid has just now said, to evaluate what is right and what is less right. Probably the science journal Nature has given some guidelines, some protocols, as a set of basic articles to be read by science. I think science communicators today are just plucking the low-hanging fruits and going to a hungry market, distributing it, and whatever is sweet is being sold. What is required now for us, in the safety of our home, in the curve flattening stage, we should learn ourselves. We should know what the mathematical models are. We should know what is epidemiology. An interdisciplinary, transdisciplinary learning curve is required for science communicators. Let us exercise restraint. In the meantime, whatever protocols have been prescribed by the governmental agencies should be communicated, diluting with that. So the role of the science communicator today is not to go on hunting for exotic information and hawking it or peddling it, but just apply restraint. Try to understand what are the protocols given by authorities and not even experts, because experts differ. We can find, for example, in the case of the mask usage, you can find the submicron particles and the various equations being used on that. As a technical expert, you might be able to have a different opinion with what the protocol is required by the government. So it is necessary for science communicators to apply extreme restraint on all our methods and see that the governmental regulations are being propagated without a diluting. I think we should play a secondary role today. At the same time, we should use this time to educate ourselves. And also there is another hazard. The hazard communication itself is a hazard. But when scientists start communicating on their petty findings, very small findings which are true and technically valid in the given sense, but this is not to be transmitted to the public directly. So scientists should exercise caution. Science communicators should give their caution. And as science journalists, which I am not, the idea of presenting two views and then giving their view on that view which you are moderating of two contrarian views, you have to exercise a much greater restraint on that. I think this is the time for restraint and reflection on our part. That's my personal view.
I'm not able to see Pallava. Is Pallava there?
Yeah.
I am very much there, sir. I will not go away so soon.
Oh, okay. You are playing a very pivotal role. I mean, sitting at home, you're very active. Just yesterday, I saw one of your interview both in Hindi and in English. You're speaking to Dr. Ella, and who was very optimistic that there is a possibility that India can have its own the vaccine for the coronavirus. What do you have to say on this, and what are the other developments taking place globally?
Well, let me thank you, Dr. Khened, Jawaid, Mr. Jayaraman, and Saket for organizing this. I think this is a wonderful way of communicating if only somebody listens to us science communicators. I think Dr. Jayaraman put it very correctly this is the time for us to go back to the basics. Look at how and why and what we are communicating. We should talk to people who understand what they are saying. Today, there are dime a dozen experts who are talking about coronavirus and the COVID pandemic in the same fashion as they were talking about the CAA and the NRC. It's the equivalent of what is happening today. So we need to know who the experts are. Is their domain specialization what they are talking about, or they are simply regurgitating facts from the internet and from the WhatsApp university? Javed does a fantastic job of correcting some of the stuff. As a frontline reporter, I do not rely on people who do not know what they are talking about. If I choose to speak to Dr. Balaram Bhargav and he tells me that Pallav, more than 95, 98% people will survive the pandemic, I will listen to him. He is the head of the Indian Council of Medical Research. But today there is a doomsday scenario which has been created, and everybody thinks they will be in that last 2%. Certainly not. The world is going to survive. There will be a day after this COVID pandemic. I have personally reported since 1994 the plague outbreak of India, every epidemic, every pandemic, and I personally don't think I fall in that 2%. My own feeling is most people will overcome this and go forward. But at the same time, listen to experts, listen to people who understand what they are saying. In the last week, I am not the one who's confined to my home. I am by law permitted to go out in the field. I am reporting extensively from the field. I go and see what the ground situation is and then talk to all the experts. Well, I will not recommend that for everybody, but yes, as a frontline reporter reporting the COVID-19 pandemic in India, my duty is to inform as accurately, as objectively, and as fairly as I can. And among that, you asked about the vaccine effort being developed by Bharat Biotech. It is certainly a beginning. It should give some hope in this gloom and doom scenario, but there is a very long way to go. It's not as if the vaccine would be ready in a couple of weeks. It will take time. No vaccine gets ready, but at least some beginning has been made. So I think there's a lot we science communicators can do, but provided somebody listens to us. Today, very few people are listening to rational scientific voices. It's the outliers who are making the maximum noise and getting more attention.
Absolutely. I mean, looking at the way the COVID pandemic is being covered extensively in the media, 24/7. What you rightly pointed out, Pallav, that a scenario is being created as if we are heading towards that doomsday. Looking at the numbers, well, it has definitely crossed 1 million people. But then, do you think it's fair, Jawaid, that we compare this of the coronavirus or the COVID pandemic with the 1918 Spanish flu pandemic, which actually killed about 50 to 75 million people? I mean, it is this fear perhaps which has made the media very hyperactive and hypersensitive, and the doomsday which Palla was talking about is being extensively talked about in the media. Is it right to do so?
I think the two events are eons apart. 1918 and almost 100 years later, we have this incident. Health infrastructure has gone up, immunity levels have gone up, and so many other things. Information is there, a lot of information is there. People are looking up information, people are following advice. We have treatment regimens coming up, teams throughout the world working on these things. So I don't really think we should compare that pandemic and the outcome of that pandemic with the one today.
Dr. Jayaraman, I had a question that do you think World Health Organization or maybe the Chinese authorities were slightly delayed, in actually informing the rest of the world, and the World Health Organization did delay in actually declaring this as a pandemic?
There is no objective scientific evidence in favor of this. Now, assuming without admitting that there has been a delay, if you look at the mathematical model, the scenario could not have been significantly altered by the initial delay. Because the scenarios which you can generate, if you see it on the time frame, if it would have been done earlier, there would have been a little better effect, certainly not. But given the situations and under the constraints and restraints of data available, the subjective decision should not have been taken, and I wouldn't find fault with a slight delay, even when the decision is out. Retrofittingly, we might criticize a decision, but that is not, we could not have taken the decision given that data at that point of time. That's my suggestion.
Absolutely, thank you. And Pallav, I had one question. It's now mandated that the surveillance has to be very perfect. We cannot afford to miss out on even one person who is COVID positive. So wherever he travels, one has to, trace him out and the contact that he has made. Under these circumstances, if somebody says that the government or the authorities are over-indulging and over-inclusive, what do you have to say on this issue?
Well, I can say yesterday I had a visit to my own house from the office of the local district magistrate. Somebody in my family had been to the airport and they backtracked and came to ask how they were healthy or not. So I think some amount of backtracking and tracing is necessary. But your point on isolation and lockdown, if you ask me objectively, I think this very vast migration and the exodus of migrants which happened in the last 3 or 4 days, which I personally saw, and lakhs of people sitting on tops of buses, walking for days together, hours together, trying to reach their homes. And if the Solicitor General of India is to be believed, who told the Supreme Court of India that 3 out of those 10 people were carrying the coronavirus, then I think if the Solicitor General is correct, then we have a major problem on hand. And trying to track and trace every person who has been walking for days together on hungry stomachs, no water, in sunlight, I'm sure when they reach their hinterlands in the villages, it's going to be very difficult. And the effort for the lockdown initially was good, but somewhere along the line, I think the management of it kind of deteriorated to a point where it has, I don't know whether to say or not, but somewhere along the line, the lockdown has diluted quite a lot. And this tracing of every individual is kind of becoming very difficult. But personally, I was very heartened to see that 2 people from the district magistrate's office turned up at my own house and checked on the whereabouts of the person from my family who was at the airport. So something in this vast democracy in these times of corona pandemic is working. And my heart goes out to the very young man and woman who turned up at my house. They are risking their lives. They are risking traveling in this curfew-bound times just to make sure that my family is safe. I think that is a lesson we need to learn, and that is a lesson we need to tell people very boldly, that many people are risking their lives to give accurate information. And many science communicators are sticking their neck out to give correct information. And we need to applaud them.
Jawaid, there is another issue. Unfortunately, what has happened is the COVID positives, in a way, are likely to be stigmatized. The society may look at them with a different point of view. The way in the earlier days, for example, the mentally retarded or differently able people were looked at as some kind of a curse or societal problems. In a similar manner, overhyping the COVID situation, some of these people who are COVID positive, they may live through it because it's just about 2% of fatalities that take place. The COVID is nothing but this is yet another flu kind of a thing with some flu-like symptoms. How do you address this? Maybe it is because of this so-called stigmatization that not many people may come forward for getting themselves tested.
See, it works both ways. As far as communication is concerned, I don't think we were able to communicate to the people in Nizamuddin, in the Markaz, about the severity of the disease. Similarly, we have not been able to communicate to people who are still holding gatherings. I find in the locality behind me, people putting out khatiyas and gossiping, 10, 15 people gossiping. And when you try to advise them, they say you go home and rest. So that communication has somehow not reached those levels where it is really required. And uh, I'm sorry, your question was what about?
The question is, for those people who are tested COVID positive, they are stigmatized, and their names. Some of these names are getting leaked out in the WhatsApp groups and things like that.
Right. See, somebody in our own fraternity, I'll not take his name. He put up something on Facebook that his house has that sticker of quarantine, and he's being harassed by his colony people.
Yes.
So that is where education, re-education, communication will all come in handy, I think.
Dr. Jayaraman, I mean, all the more this point is important because even the doctors were not spared. For example, the All India Institute of Medical Science AIMS resident doctors who were doing their duty, but then perhaps there is a likelihood that they are the front-end staff and they may have been, there is a likelihood of their being infected. So they were denied of their, stay in a residential complex. How do we address this issue and tell them that, look, I mean, the possibility of one getting infected with the COVID positive is very less, and even among that, the fatality is just about 1.8 to 2%. How do we emphatically, communicate this message among the public?
We have a classical example of the leprosy eradication program. We call it the Hasan disease. Now we don't use the word leprosy itself. So the Indian Development Foundation has been active in the field for the last 20 years on eradicating the ostracization aspect of leprosy. And we have been able to successfully do that. Initially, right at the moment, you may find a certain amount of negative response to those who have survived the COVID-19 situation. But I think this is a transient condition. For example, the two elderly couples which have just come out of the Kerala hospital, they were not being ostracized. They are being admired for their ability to withstand the crisis. So making an atmosphere. And if you do it successfully for Hansen's disease, which was much more visible ostracization, this will be much, much less. Although at the moment, since we are at the front end of the country, we might feel we are doing a problem. I hope and trust the transient condition and the old communication strategies which are employed for other communicable diseases would equally be applied to this. And Hansen's disease is a classical example.
Pallava, we're coming at the fag end of this session. I was just wondering, people keep talking about the mathematical modeling and then look at the doomsday. They tell that we are following the path of, we may soon follow the path of Americans or things like that. And by end of April, we reach about 1 lakh or something like that. And you started with a positive note. So I want you to give your concluding remarks about what you feel about the possibility of the COVID situation, say when we reach at the end of, say, May or April.
Well, so mathematical models are only as good as what goes in. So garbage in, garbage out. There are lies and there are damn lies and there is statistics. Okay. So mathematical models need to be viewed from that perspective. End of the day, ground data is what is most important. And that data is only being started to be gathered in India. We are at the beginning of what could be a very long phase in this coronavirus pandemic. We don't need to panic. We need to carefully, rationally, and scientifically understand and take it forward and believe that 98% of us will survive.
Javed, you're playing a very important role. Your publication is perhaps will not be there now. The printed publication will not be there. But Ed, how do you ensure that the information reaches a lot of people? Science Reporter is one magazine which hundreds of thousands of people follow, both the printed version and the online. What do you have to say about this COVID situation? And then how do we look forward to an era after the COVID, or maybe as we go towards the end of COVID?
See, this has been a very unique incident, and many people have never faced such an incident. So there will be slip-ups, there will be mistakes. It's going to be a great learning experience. And for us also, communication-wise also, it's a very great learning experience. We were really not prepared to sit at home and bring out the issue. We have already brought out the issue. We have talked to our artists and done the layouts and done it online. But this is something that has to be a learning experience, in the sense that we should be prepared for such events, even after this one ceases to be as scary as it is right now. So communication-wise also, we need to really ramp up online communication in a manner that we have not really done until now.
Dr. Jayaraman, what do you feel of is the when we have such events, for example, on-site museums like the Science Centre, what do you think they should be doing under these circumstances? Because whatever we have been doing is basically through our social media networks. Other than this, we have not been very effective, in my own humble admission of the fact that we were ill prepared. So what do you suggest for people like us?
I would suggest that you should get connected to the innovation hub where people have been doing wonderfully well. And on a digital platform, you should be able to do some projects directly relevant for COVID-19 pandemic. For example, the portable, low-cost, high-value ventilators. There are several concepts which are extremely relevant today. And you have connectivity with some of the finest group, children. So on a digital platform, if you can bring them and also make your mentors available to that will be a great idea. I want to make one statement. As a science communicator, along with my colleagues in Kerala, the Kerala Shastra Sahitya Parishad, we have more or less decided that we'll keep a moratorium on communications of the and to go on a learning curve. But I also find in oral communication, we have an iconic character, Dr. Anthony Fauci, with competence and confidence. And that's a model which psychomers should look up to and exercise restraint and reticence and absorb useful data. And you can come out with in-depth articles a little later.
Last 1 month.
Oh, thank you so much. It's been a pleasure. And I know this was the first time that we are trying to use this platform for trying to understand what the role of science communicators is. Thank you again, and hope that things improve. And if in case we come to a stage where the science centers are open, fine. If not, what we need to do is, can we use this platform again to gather more and more people to communicate science? Thank you again.
Thank you everyone for giving your valuable time from your home. Stay safe, stay at home.